Today for Primetime Local News, I'm joined with Dr. Julie Krasowski, the Deputy Chief Medical Health Officer with the Government of Saskatchewan, and we're going to talk about the risks of hantavirus and ways to keep yourself safe and protected during your spring cleaning. So thank you so much for joining us here today.
Thanks for your interest.
So first, let's start off with, do you have any tips for people when it comes to doing their spring cleaning?
Yeah, because of the risk of hantavirus, advice to people who are doing spring cleaning is to take steps that reduce the risk that they might come into contact with deer mice or the droppings of deer mice, which are what carries hantavirus and pose a risk to human infections. So to that end, we would recommend that people who are doing spring cleaning watch for signs of a rodent infestation. So those signs might include things like rodent droppings or signs that rodents might be nesting. They often nest in stored machinery or vehicles or in wood piles. So watching for signs of rodent infestation. And if you see any of those signs, then to take precautions if you're going to be doing cleaning in that area.
And if somebody were to start doing their spring cleaning and they weren't wearing any personal protective equipment and they saw these warning signs, what would you recommend that they do next?
So I would say before going any further, stop. So if you do see those signs of a rodent infestation, then stop before going any further. If it's an enclosed area, it would be important to ventilate the area. So open up doors and windows for at least an hour before doing any cleaning within that area. And then take that time to get equipped with some personal protective equipment. Those would include things like wearing gloves and using a mask, a well-fitting face mask. N95 respirator type mask would be the best choice, but any other type of face covering would also be recommended to help provide some protection there. And then when you're doing the cleaning of that area, using wet cleaning methods rather than dry cleaning methods. So you want to avoid doing anything that will raise a cloud of dust or create aerosols and airborne particles that might carry hantavirus. So those wet cleaning methods include using a bleach solution to wet the area that needs to be cleaned, and then using mopping as a way to clean up any of that wet material that needs to be disposed of, rather than using things like dry mopping or sweeping, which can create clouds of dust. So by taking those steps, and then of course disposing your gloves and cleaning your hands afterwards are all ways that you can keep yourself safe and protected when doing cleaning and protecting against hantavirus.
And what are the symptoms of hantavirus and when do they typically start?
So the typical signs of hantavirus usually occur about a week or 2 to 3 weeks after you've had an exposure to the rodent droppings, usually that are contaminated with hantavirus. And the first symptoms that people typically experience are headache as well as muscle aches. And it's usually the large muscle of the body, including in your back or in your legs. So those are the most common typical symptoms. And then usually following that, nausea, vomiting, or gastrointestinal symptoms occur quite commonly. And then progressing usually within a few days to hantavirus pulmonary syndrome. Doesn't happen all the time, but if it does, it progresses rapidly and that can be fatal. And the symptoms of that progression to hantavirus pulmonary syndrome include shortness of breath, a cough, trouble breathing, low blood pressure also goes along with that. And that is a medical emergency and can be fatal.
At what point would you recommend going to see a doctor?
So people who think they may have had an exposure to rodent droppings and are concerned that the symptoms they have might be due to hantavirus should seek medical attention immediately. They should inform their physician or healthcare provider that they may have been exposed to rodent droppings and they're concerned about hantavirus. And ideally, they would be seeking attention as soon as they experience those early symptoms, usually headache, body ache, fever, fatigue, or abdominal symptoms as well at that point.
And what advice do you have for people who are trying to prevent an infestation?
So steps people can take to avoid coming into contact with deer mice are to make the environments around their home not attractive to deer mice. So cleaning out places where they might hide, moving wood piles away from the home, further away from a house, sealing up cracks where mice can get in through foundation or cracks in doors or underneath equipment, for instance. So all of those things can reduce people's risk to hantavirus by reducing the risk of coming into contact with the deer mice in the first place.
Thank you so much for your time.
Oh, you're very welcome. Thank you.